Because you got somebody actually looking after your health if you're not looking after it. And that's what that home monitoring service do. Whether you're concerned about yourself or not, we are.
Remote patient monitoring is a program for our congestive heart failure patients at Orlando Health. It is a program where the patients are able to take part in their health care and the comfort of their home. And they do this by taking their vital signs at home every day on a daily basis. And our nurses are able to see those vital signs and review them and able to reach out to the patients whenever they notice any abnormal or out of range vital signs for the patients.
When they recommended it, there were certain rules and regulations you had to follow along with it. For instance, at the beginning in the morning when you wake up, you must make sure you empty your bladder and make sure before you get on the scale, you're just right for doing what you're doing. If something be abnormal and not right, I would get a phone call from Miss Tammy. So one of her staffers would call me and ask me, is everything all right? And I said, I'm all right. She said, you're not, Mr. Stubbs. You're not all right. Either the heart is moving too fast, or like I said, my high blood pressure is really out of whack. And then if I gain too much weight at a certain time, they say something is wrong with that. You picked up too much weight. And in that time, they would recommend you need to get to the hospital, you need to get with your doctor.
I would just encourage him to make sure he's staying on track with taking his medications as prescribed and making sure he understands those warning signs and learn when and how to contact his provider, because we want to make sure he's staying well and keeping him out of the hospital. So with our kits that we provide with the patients, we have a cellular cell hub that is in with our kit, and that connects to a cellular tower around the patient's home. They don't need Wi-Fi in their home. It's a cellular connected device, and that our other equipment, the blood pressure monitor and the scale and the pulse ox, are Bluetooth, and they connect to that device, and that transmits the patient's readings to our nurses' computers.
If anybody that have these issues, they need to consult with their heart doctor. So I heard about this program. It's a home monitoring system that will keep up with you. And I need to know, can you help me get this? Everybody want a new car, a new pair of shoes, but you not be able to get it, but you can monitor your heart enough. And you can add another 5 to 10 years on your life by following these instructions.
Mr. Stubbs, when he was worried about his vital signs, he would also give us a call and say, hey, I'm worried. And we were able to provide some comfort with him and understanding and education, and so that he had that good understanding of what he needed to do to keep his vitals where they needed to be.
I would not be here talking to you all today if I hadn't been following instructions. Because that blood pressure and that heart stuff is dangerous.